Hello everyone, this is Mila. Today I'm reading Chapter 8, Chemoprevention and Cancer. Nothing is more difficult for me than having to tell a patient he or her has a cancer. Yet cancer is diagnosed, I must anticipate report as a routine part of my job. Doctors all over our nation have to share the same grim news with their patients. More than 1.3 million new cases will be diagnosed in the United States this year. Approximately 550,000 patients will die from cancer before the ball drops in New York City's Times Square again. In spite of the $25 billion spent on cancer research in the past 20 years, deaths from cancer have actually increased over the same period of time. Major concern has arisen among researchers and clinical alike. It's time to rethink our approach to cancer prevention and treatment. But you may ask, has the researcher made some great progress? Indeed, we have achieved some improvements, but those lie largely in the realm of being able to detect some cancer sooner through advances such as mammogram for the detection of breast cancer and PSA tests for prostate cancer. Is earlier detection all we can hope for? No. In this chapter, we will discuss some of the most recent advances in cancer research and how you may be able to lower your risk of developing cancer. Cancer and its cause. Doesn't it seem that just about anything we do or eat these days allegedly cause cancer? Excessive exposure to the sunlight increases the risk of skin cancer. Asbestos workers have increased risk of developing an unusual form of lung cancer called mesothelioma. Smoking and secondary smoke are the main reason lung cancer is leading cause of cancer deaths. Radiation, charcoal sticks, too much fat in our diet, cyclochain, and the many other chemicals found in herbicides and pesticides are what medical literature refer to carcinogen, or those things that increase our risk of developing cancer. Since the first report that chimney sweep had increased risk of skeletal cancer because of their exposure to soot, we have become more and more afraid of our environment, and rightfully so. As I mentioned earlier, our blood face exposure to far more chemical than any previously generations did. And what is the one common denominator all these synergies have? You guess it? They all increase oxidative stress. Here lies the key to understanding new strategy for fighting cancer. Oxidative stress as the cause of the cancer. Many researchers have offered theories as to what is the underlying cause of cancer. Unfortunately, not one of these theories has been able to explain completely diverse aspects of cancer and the development of disease within the human body. In responding to this medical conundrum, Dr. Peter Kovic authored a comprehensive review in Current Medical Chemistry 2001. There he stated, of the number of theories that have been advanced, oxidative stress is the most comprehensive, and it has stood the test of time. It can rationalize or correlate most aspects associated with carcinogens develop cancer. COVID research support growing medical evidence that when excessive free radicals are allowed to exist near the nucleus of the cell, significant damage to DNA of the cell can result. The DNA of nucleus is especially vulnerable when a cell is diving, during which time the DNA strand is literally unwound and stretched out. Researchers are now able to confirm not only that free radical can damage the DNA nucleus of a cell, but also which strands of DNA they damage most frequently. When met with an onslaught of carcinogen, the body mesh unit will be busy trying to repair the damaged DNA. But in time of heavy oxidative stress, free radical damage overwhelm the repair system can lead to mutation of the DNA. Free radical can also weaken damage on the genetic structure of the DNA, which can lead to abnormal growth of cells. These cells continue to replace. This mute DNA is carried each day newly developed the cell. When there is further oxidative stress to this mute DNA of cell, more damage occurs. The cell will then begin to grow out of control, take on life its own. It develops the ability to spread from one part of body to another, metastasis. Those become a true cancer in Figure 1. A multi-stage process. Dr. Donald Moline, a biochemist from Seattle, reported a new method for identifying structure change in the DNA of breast tissue. By using instruments that bonds infrared radiation of the DNA and by analyzing the signal via sophisticated computer, he is able to follow in the structure damage to the DNA caused by free radical. Researchers agree with Malin that the development of cancer is a multi-stage process that usually takes decades to develop. In adults, cancer may take 20 or even 30 years to develop from the initial mutation of DNA to full-blown manifestation. In children, this process may progress more quickly because there are more rapidly cell turnover. Marlin noted significant change with the structure of DNA. He followed it from normal breast tissue to metastatic breast cancer in all its developing stage. Dr. Malin believed oxidative stress was the cause of this predictable damage to the DNA, which eventually led to the formulation of breast cancer. He further argued that cancer was not so much the result of dysfunctional genes as it was the result of genetic damage that highly reactive free radical cause. For the past 25 years, researchers have believed that abnormal genes are the driving force behind all cancer. But now researchers are beginning to believe instead of an individual who certain genes are simply more vulnerable to oxidative stress than others. This may explain the family pattern of many types of cancer. A dedicated letter and dollar short. Physicians usually diagnose cancer in the past or the last stage of its development. Unfortunately, by the time a cancer is advanced enough to cause symptoms or show up on X-ray, it actually usually being developed for more than 10 to 20 years. Doctors get out of big guns, aggressive surgeon, chemotherapy, radiation, only to realize that most often they can do little to help the patient. The last time I diagnosed lung cancer in one of my patients, his oncologist recommended chemotherapy, a procedure through which the physician claimed he could bring the lung cancer into remission about 40% of the time. My patient was somewhat encouraged by the study until he asked just exactly what was meant by remission. The oncologist answered, "If the cancer is successfully brought into remission, your life can be extended by about 3 months. Needless to say, this was not what my patient had hoped to hear. This is the typical tragic story for most people with cancer. When my own mother was diagnosed with a high-grade brain tumor, the radiation therapist said there was about 1% chance that therapy could prolong her life. Against my wish, mother went through the treatment. She died 6 months later after battling not only the cancer but also treatment that left her weak and ill. Aggressive treatments may extend a life a few months to even a year or so long, but the suffering our patient and loved one must endure for the marginal benefits seems cruelty to those whose lives are already so fragile. We're presently losing the battle against cancer. Is there any doubt that this malignant disease must be attacked at a much earlier stage in its development, before the number of deaths will decrease? We do have hope, understanding the role of the oxidative stress in the development of cancer, offering us a host of a new possibility in prevention and treatment. Prevention of cancer. Chemoprevention. As we begin to understand the root cause of cancer, therapeutic options become unavailable. Since cancer is a multi-stage process that takes years to develop, numerous opportunities arise to intervene in this process. In the earlier stage of cancer, we see changes primarily within the DNA, the nucleus itself. The mutation that occur via the free radical attack of the DNA pass to each subsequently cells as it replicates. Eventually, because of the further free radical damage to the cell, a pancreas tumor develops. This is the first particular level that we can evaluate clinically. The final stage is the developing of frank malignancy or cancer, which has the ability to spread from one part of the body to another. Differently from attacking cancer with treatments in this final stage, chemoprevention focuses on preventing the cancer from developed earlier stage. Remember, the balance is the key. If we have enough antioxidants available, oxidative stress does not occur and the DNA of the nucleus is safe from initial damage. Imagine against the metaphor of the fireplace. When a screen is in place, cinder cannot pop out on the carpet. Chemoprevention also aims to reverse the damage that has already occurred to the cell. As you learn in Chapter 4, the body has the amazing ability to heal itself. Remember the mesh unit. Let us now carefully consider a strategy for fighting off cancer in 3 planned phases of chemoprevention and the effects each has on the body. Chemoprevention phase 1, decreasing the risk. The first strategy in the prevention of cancer may seem obvious whenever possible. Eliminate or at least decrease the exposure to carcinogen chemicals that we know increase our risk of cancer. So seemingly obvious, this phrase is much easier said than done. Here are steps you should take immediately to decrease your risk of cancer. 1. Stop smoking. Cigarette smoke is the most potent carcinogen to which many of us are exposed. So nicotine is a terrible addictively. We must struggle to get rid of the body of its all the carcinogens and contained in cigarette smoke. Smokers now shows tremendously increase in the number of free radicals in their body. And through a lesser extent, secondary smoke is also an important factor in oxidative stress. 2. Reduce your exposure to sunlight. UVA and UVB, ultraviolet light, is a well-known carcinogen. I strongly recommend using sunscreen that protect against both. It's a discipline you can't live without. Parents protect your children. 3. Eat a low-fat diet. Excessive fat intake at meal is known to introduce oxidative stress. Especially when adequate amounts of antioxidants are missing in that meal, we must decrease saturated fat intake, making certain we consume at least several servings of fruits and vegetables and more than 35 grams of fiber each day. I know you have heard that all this before, but less than 99% of population follow this advice. 4. Beware of other carcinogens. Whenever possible, choose to take action in decreasing your exposure to cancer-causing agents such as radiation, pesticides, herbicides, asbestos, charcoal, soot, and so on by pursuing them from your home and environment. A principle you will learn to appreciate is that if we reduce our exposure to all these carcinogens, we will produce a few free radicals to our body to fight. For example, it is difficult for me to recommend eating a healthy diet supplement with nutritional medicine to a patient who is smoking 2 packs of cigarettes a day. I know the effects will be minimal at best. And unless he starts smoking, chances of decreasing the risk of cancer are definitely compromised. Chemoprevention phrase 2. Maximize the body's antioxidant and immune system. It is possible to avoid exposure to all the carcinogens and chemicals in the environment. We must still live in this world, hesitating with fear of what might be out there, will only rob us a full of abundant life. As you have already learned, the mere fact that we need oxygen to live puts us in significant risk for oxidative stress. Therefore, the best strategy is not to hide out, but to maximize your own body's immune system and antioxidant defense. And this begins by eating a healthy diet. It seems logical that if oxidative stress is indeed a cause of cancer, antioxidants used to bring free radicals back into balance would lower the risk of cancer. This logical proven true. Cancer researcher specialized Dr. Glady Block followed this precious logical while reviewing 172 epidemiology studies from around the world on diets and cancer. Dr. Block discovered a universal and consistently finding those individuals who had the highest intake of fruits and vegetables. The main source of antioxidants shows a significant decreased risk of developing almost every kind of cancer. The risk of developing most cancer was 2 to 3 times less for those who had the highest intake of fruits and vegetables compared to those who had the lowest. The opposite holds true. Dr. Bruce Ames, a leading cancer researcher, stated in an interview with the Journal of the American Medical Association that individuals who consume the least amount of vegetables and fruits have twice as risk of cancer as those who consume more. Merely by consuming 5 to 7 servings of fruits and vegetables daily can decrease the risk of almost every type of cancer itself. The absolutely best defense your body has is good diet. Nothing a doctor can prescribe will take the place of the diet your body needs to fuel and replenish itself. One of the principles you will hear me stress over and over is the fact that if you choose to use nutritional supplements, you must supplement a good diet, not a bad one. The first step towards building a strong immune system is to eat a high-fiber, low-fat diet, largely made up with fruits and vegetables. But we may need more to practice chemoprevention. Medical research is beginning to demonstrating that taking antioxidant in supplementation to our diet is very important in chemoprevention. Study shows that supplementation of good diet over a 20-week period of time with vitamin C, vitamin E, beta-carotene results in significant decrease of oxidative damage to the DNA of both smoker and non-smoker. Vitamin E also has been shown to protect against exercise-induced DNA damage. Chemoprevention Phase 3, empowering the body's repair system. In Phase 1 and Phase 2 of the chemoprevention, we were primarily concentrate with the decreasing the amount of oxidative stress the body has to handle and providing adequate antioxidant to prevent such stress to the DNA of cell. In Phase 3, we will focus on the body's amazing repair system when coupled with adequate nutrients able cells to repair significant damage has already occurred. Pancreas lesions or growths offer us a unique insight into use of antioxidants in chemoprevention. It is difficult to follow this tumor within the body, but many studies have followed such a tumor on the surface of the body. Such studies primarily look at the leukoplakia, which is a pancreas tumor found inside the mouth of tobacco chewer, and the cervical dysplasia, the pancreas tumor on the surface of the cervix. We hope that by observing the use of raised antioxidant on the tumors, we will gain insights into the possible effects on the already damaged DNA. Remember, cancer is a multi-stage process. Even pancreas tumors are in a relative advanced stage. The next step in the multi-stage process is to develop a true cancer itself. As you may imagine, great interest has popped in the prevention of treatments of leukoplakia. Several studies have shown those tobacco chewers have lower antioxidant level. Consequently, those with a high level of antioxidant also demonstrate a lower risk of developing leukoplakia. Dr. Hinder wrote a review article on the effect of antioxidant not only in the prevention of oral cancer but also the reverse of leukoplakia. This article is a landmark to phase 3 of chemoprevention. His findings provide hope that not only can antioxidants help the process of developing cancer, they may actually empower the body's repair system to reverse cell damage. I'll briefly recap in the box several of the clinical trials he studied. Here's the list of studies that involve the use of nutritional supplement in patients with pancreas lesions. 1. A study in India used vitamin A and beta-carotene. Researchers observed complete remission of leukoplakia at rates 10 times greater than the placebo group. 2. A pilot study that used only beta-carotene shows a reversal of leukoplakia back to normal cells in 71% of their patients. 3. In an ongoing study in the United States, patients receive a combination of beta-carotene, vitamin C, vitamin E. Researchers witnessed a response rate of 60%. The abnormal pancreas cells revert back to being normal cells. 4. In an ongoing multi-institute U.S. trial, patients received only beta-carotene that they had a response rate of 56%. 5. A study done with some male hamsters that had experimental induced oral cancer considered using beta-carotene, vitamin E, glutathione, and vitamin C, both in combination and alone. Significant improvements occurred in each group. However, the group receiving the combination had by far the best result. This was not merely additional effects as more and more antioxidants were used, but rather than the result of synergistic effects of supplemental work together. Cervical dysplasia is another pancreas tumor that occurs on the surrounding face of the body. Several studies have shown that individuals with lower level of beta-carotene and vitamin C have significantly increased risk of cervical dysplasia. In fact, women with a lower level of beta-carotene had a 2 to 3 times more risk than women who with the higher level. Women had the intake of less than 30 milligrams of vitamin C per day had a 10 times greater risk of cervical dysplasia than women who intake higher. Other epidemiological studies have shown that dietary deficiency in vitamin A, vitamin E, beta-carotene, vitamin C increase the risk of cervical cancer. Beta-carotene supplementation actually has been shown to prevent cervical dysplasia from progressing and cervical cancer. In addition, some clinical trials have shown the role of vitamin C, beta-carotene in reducing risk of cervical dysplasia altogether. So the medical science attempt to find the one magical bullet nutrients in each of these specific cancer. As a clinician, I try to determine principles that will be benefit for my patient. After a research study like the one mentioned here, I have no doubt these antioxidant nutrients work together in synergy. As I said in chapter 5, this means we not only need a assortment of different antioxidants, but we also need the minerals, magnesium, zinc, selenium, and copper, and the B vitamin that support their enzyme functional. I'm awed by the incredible ability God has built into the body to not only protect itself against oxidative stress, but to repair damaged wounds on the DNA of the cell. Several ongoing clinical trials will further determine the role of antioxidants in reversing this process of carcinogenesis. In the meantime, remember, leukoplakia and cervical dysplasia are the very end of center multi-stage cancer. And yet studies show how the body can repair itself when we provide with optimal level of a few select antioxidants. What if I already have cancer? Granted, chemoprevention therapy really exists for individuals who have not yet developed full-blown cancer. And standard therapy for cancer doesn't always appear promising. This therapy involves surgery when feasible, chemotherapy, and radiation for solid tumors such as cancer found in the lungs, the breast, the colon, and so on. In the spike of medical research efforts, this therapy seems to have reached a plateau. The bad news continue. Despite evidence of increasing cure rates in the treatment of Hodgkin's lymphoma, childhood leukemia, and testicular cancer, there's growing fear of developing of secondary cancer complications that are the result of this treatment. The good news lies in the fact that medical research is beginning to support the idea of supplementation. With a mixture of antioxidants, supporting nutrients, this mix can actually enhance traditional chemo and radiation therapy while at the same time protecting normal cells from toxic effects. Kimberly's story. Kimberly was in her 40 years at Westmont College in Santa Barbara, California, working towards her degree in communication arts when she developed abdominal discomfort and bladder pressure. She went to the campus doctor, who diagnosed her having a bladder infection and prescribed some antibiotic. But Kimberly's condition worsened. She experienced increasing abdomen pain, nauseous, vomiting. While lying down, she was able to feel a mass in her lower abdomen. Obviously, this frightened her terribly, and she went back to her doctor immediately when he re-examined her. He could feel massive the size of grapefruit. He ran a blood test called a CA125, which is a cancer marker for gynecological cancer and bowel cancer. Kimberly's marker was extremely high and surgery was scheduled right away. At age 21, Kimberly had ovarian cancer. This being an unusual disease for such as a young woman, the diagnosis caught her and her family totally off guard. After surgery, the surgeon was quite optimistic that he had removed it all. He wanted to take every precaution, however, and request that Kimberly see the oncologist. Her oncologist insists that she going through some heavy chemotherapy. Primarily because of her young age, she still had a lot of life ahead of her. It was about this time that Kimberly consulted me. She wanted to know about nutritional supplement as she was going through this supplement treatment. She started an aggressive nutritional supplement program and scheduled her chemotherapy. Kimberly did not want to drop off school even though her doctor strongly recommended. She was one student who was determined to give it her best shot. So she scheduled her chemotherapy treatment in Santa Barbara, where she would continue to attend class if it's proved possible. The young communication major did remarkably well through her treatment. She was able to carry a full load in college, but Kimberly, oncologist surgeon, comment on not only how great she looked, but also on how well she was tolerating her treatment. She did lose her hair, but she did not missing many class. During her last treatment, the oncologist walked over to Kimberly, asked her directly, "What are you taking?" "Looking up," she replied. "What do you mean?" he said. "I know you have to be taking something because all my other patients are over there vomiting, but you are here reading Time magazine." When she told him that about nutritional supplement she's been trying, he was impressed. Not only had she tolerated her treatment well, but she had responded so well to them. Kimberly continued to thrive. It has been more than 3 years since she finished her chemotherapy. Her hair has come back beautifully, and she is enjoying her life. Her CA-125 blood counts have remained normal, and she is now having them checked only twice a year. Kimberly has had no signs of recurrence of her cancer. Why they work? Oncologists and radiation therapists usually discourage the use of antioxidants in patients receiving treatments for their cancer. Why? Physicians are concerned with the possibility that antioxidant supplement will build up the antioxidant defense system of the cancer cells and results in making their treatments less effective. Since their treatments primarily destroy cancer cells by creating oxidative stress, this is a reasonable concern, but the medical literature does not support their position. Dr. Kader Fres and Alon Kuma and their colleagues at the University of Colorado Medical School Radiology Department reviewed more than 17 studies to address this concern. They titled this report, "High Doses of Multi-Antioxidants Vitamins, Essential Ingredient Improving in the Efficiency of Standard Cancer Therapy," which appeared in the Journal of the American College of Nutrition. There, Dr. Purisette and Kumar notes a few scarce study that shows negative effects of using one nutrient and supplementation with certain chemotherapy treatment. One high dose of multiple antioxidants were used together. However, the therapy were enhanced. Now, why would this happen? Antioxidants help destroy cancer cells. Clinical research is revealing that cancer take up antioxidants differently than normal cells. Normally, healthy cells will take up only the amount of antioxidants supporting the nutrients they need. This is a very important scientific fact that when it comes to principle of cellular nutrition. Cancer cells, on the other hand, continue to absorb antioxidants supporting nutrients without knowing when to quit. This intake excessive antioxidant actually make the cancer cells more vulnerable to cell death. Antioxidants not only aid to the battle against the cancer cell, they improve defensive of healthy cells against damaging effects of radiation and chemotherapy. antioxidants help good cells. It is common knowledge that almost all of the harmful side effects, chemotherapy and radiation therapy to normal cells are the result of increasing oxidative stress this treatment creates inside the body. What is not common knowledge, however, is that when a patient takes a high dose of antioxidant supplement, he improves the defense system normal cells since they taking up on the antioxidant normally. They create a true win-win situation. Chemo and radiation therapy can work at a perk while at the same time the terrible side effect and damage that occur in the healthy cell significantly reduce. Vitamin E protects against the damage caused by the various chemotherapy against the lung, kidney, livers, heart, and skin. Q10 has been shown to protect against the long-term damage to the heart that the drug adrenaline causes. Beta-carotene and vitamin A reduce the adverse effects of radiation and some chemotherapy against. All of these antioxidants have been shown to help protect against damage to normal cells that can treatment cause. Michelle's stories. Michelle was a beautiful, variable 4 years old. Her words was filled with love and lots of laughter. It appeared that nothing could penetrate the safe haven of her family. But Michelle's carefree life changed. Doctor discovered the discomfort she was experiencing in her back and abdomen came from the aggressive cancer called neuroblastoma. The family was devastated. Michelle underwent exposure surgery shortly after diagnosis. When the surgeon emerged from the operation room, the family could see from his face that the news was not good. He informed that Michelle's tumor had spread, stretching clear up to her diaphragm, and had wrapping around the bowel and enlarged veins in her abdomen. There was no way he could remove it. Before Michelle even recovered from her exploratory surgery, her oncology team started her on aggressive chemotherapy, but still was not optimism about Michelle's chance for a long-time survival. This is when Michelle's mother consulted me. She wanted to do everything possible to protect her daughter from the potential side effect of treatments that doctor recommend. When we start Michelle's aggressive nutritional supplement program in spite of her doctor's objection, Michelle was a trooper and took her supplements faithfully. Her treatment began, and she struggled through them. She did become fairly thick, even though she was taking the supplements, because the treatment were especially strong. There was serious concern that she could actually survive them, but brave little Michelle made it through, and the tumor shrank significantly. Michelle's response to encourage her doctor that they want to take her back into surgery to see if they could remove the tumor. This time, the surgeon emerged from the OR with a smile on his face. He said that they feel they were able to get out of the tumor. The oncologist informed Michelle's parents that her response to the chemo could not have even better. But Michelle's journey was not over. The doctor still want her to go back through a bone marrow transplant to ensure that any microscopically spread of the cancer was removed. The family faced another tough situation. They carefully considered all the information they could gather. And then based on that information, Michelle's father told the oncologist that they could consent to the bone marrow transplant. The physician could proceed on one condition only. Michelle's parents insist that she would be on nutritional supplement during the bone marrow transplant. At first, oncologist refused. She believed the nutritional supplement would block the effectiveness of her treatment. When Michelle's father asked the oncologist if she had any study in the medical literature that supported her concern, the oncologist replied, "No, but it is theological concern." Then Michelle's father, who was also a ER physician, revealed that she had been taking nutritional supplement all time her previous treatment. She had not only survived the treatment but experienced an exceptional response. Michelle's father made it clear that he and his wife insist that she stay on the supplement while going through the bone marrow transplant. The oncologist agreed to have the oncology pharmacologist investigate the supplements Michelle was taking to be sure there will be no conflict with the drugs. After extensive research by the pharmacologists, all agreed Michelle could receive supplements during the bone marrow transplant after all. The procedure was rough, but she survived, and she did recover. In fact, the oncologist told the parent that she had never seen any child recover more quickly from such a procedure. Their tough stint had been well worth the effort. Michelle and her mother prayed many times through those difficult months that when she returned turning 5, she would be able to start kindergarten with her friends. And Michelle was strong enough to make it first day of kindergarten. It has more than 3 years since she was first diagnosed with cancer. At age 7, Michelle is busy riding bikes, jumping ropes, and keeping up with fashion and her girlfriends. Nutritional science offers us the greatest hope in our fight against cancer and several other degenerative diseases. They not only help prevent cancer, but may actually enhance the traditional chemo and radiation therapy. How can the process of building up the body's natural defense be bad? Shouldn't physicians want their patient to be as healthy as possible? Since cancer treatments are going to put patients under the greatest stress they had endured in their lives. Natural antioxidants and their supporting nutrients are the ideal chemopreventive agents for many reasons. They limit, even prevent the free radical damage to the DNA nucleus of the cell. Prevent the proper nutrients needed for the body to repair any damage that has been done already. Are safe and may be taken over a long time. Pharmaceutical drugs do not share this advantage. Tamoxifen, which has been shown to decrease the risk of breast cancer, has very serious side effects. Are relatively inexpensive. The nutrients I recommend for prevent costs between $1 to $1.5 per day. Provide the best defense against further advance of cancer. Protect the body against oxidative stress, chemotherapy, and radiation created. Impels the cancer fighting against ability chemotherapy and radiation. Inhibit the replication growth of the cell. have been shown to cause tumor regression in some instances. We cannot deny that the effectiveness of traditional cancer treatment has reached a plateau. Oncologists and radiation therapists must become more open-minded about antioxidant use in their patients. As researchers seriously consider the use of multiple antioxidants at the optimal level, cancer prevention and our treatments may be revolutionary. In the meantime, the research that is presently available support the use of antioxidants in all stages of chemoprevention and cancer therapy. Thank you for watching today. Next chapter, I will be reading Chapter 9, Oxidative Stress and Your Eyes. See you next time.